if you've had a traumatic brain injury, whether it's a mild one, an mTBI or concussion, or it's the other end, it's a severe traumatic brain injury, and you're a service member or a veteran, please consider taking advantage of the amazing system of care that is across the Department of Veterans Affairs. It's called the Polytrauma System of Care. And it was established during the Afghanistan and Iraq conflicts to specifically take care of individuals that had combat-related injuries. But it's there in place across the entire VA system in the United States for all service members and veterans who have rehabilitation needs, who have had an injury to their brain and have ongoing needs, whether it's a mild injury, concussion, or severe. You don't have to have been injured in combat. You could have been in a motor vehicle collision. You could have even had a sports-related injury. You didn't have to be in active duty service when it occurred. The Polytrauma System of Care, which is available to some extent at every VA inpatient and outpatient program in the United States, and they're all linked together. That service is available for you as a veteran, as well as an active duty service member. Your VA, your Department of Defense cares about you and wants you to take advantage of that care. Sadly, less than half of you who have benefits for the VA, including those with traumatic brain injury, take advantage of those benefits. So I would encourage you to please take advantage, even maybe if you've had a bad experience in the past or you couldn't quite figure out how to get into the system, please take another shot at it, all right, and get involved in the system. I would even be so bold as to say, please feel free to reach out to me. It's kind of one of my jobs in the VA is to help veterans and service members who have had brain injuries or other difficulties and can't quite figure out how to get into it, or maybe have had a bad experience and really are kind of unclear on it. Reach out to me. I'd love to really help you and point you in the right direction. All right. Your VA is spending millions of dollars, and your Department of Defense, $1 million every year to keep this up and running for you, to have the best and the brightest take care of it. And they're also spending lots and lots of money to look at the short and long-term effects of these injuries on veterans, so we can predict things that can be done to prevent long-term problems, like long-term problems with headaches or dizziness or memory problems, or even things like dementia or Parkinson's disease related to these kind of brain injuries. We're doing lots and lots of research, have programs set up to care for folks just like you. If you have difficulties, have concerns, or just have questions. So please take advantage.